about 34 weeks pregnant, and I had no issues. The entire pregnancy was amazing. Like, she was healthy, she was growing just like she should. And then on the 34-week mark, a few days later, I got really, really sick. I just, all of a sudden at night, I got a really bad fever.
So in March of last year, Harley came in. She was 20 years old, I believe she was. She was about 35 weeks pregnant and came in with some respiratory complaints. Turned out she had H1N1, the swine flu, and she quickly decompensated actually after admission, requiring intubation. So she was put on a ventilator to support her lungs. And at that point, the baby had to be removed. So they did an emergent cesarean section because the baby was in distress. The baby actually did quite well, but following the cesarean section, which was done very quickly, she then began to decompensate even further. So despite maximum therapy on the ventilator, she was doing very poorly and was essentially dying at that time. Her heart was starting to fail. I went and saw Harley in the ICU with her family there, and saw that she was not going to make it. So this new mom was not going to make it, and this baby wasn't going to have a mom.
In the months before Harley came to the ER, Northeast Georgia Medical Center had begun training their team for extracorporeal membrane oxygenation, or ECMO. ECMO is a life-saving procedure which removes blood from the patient, oxygenates, and rewarms it, then returns it to the patient's body. The equipment does the work of the heart and lungs while the body heals. But the team at NGMC did not yet have privileges to offer the procedure, so Dr. Craig Brown, Dr. Allison DuPont, and hospital administration went to work initiating emergency privileges. Once granted, Dr. DuPont went to the ICU to have a very difficult conversation with Harley's family.
We basically told them that without it, she was certainly going to die. With it, she may die, and that she was going to be the first patient that we had on ECMO here, and it was new to us. And they voiced understanding and put their trust in us.
I remember whenever I woke up, honestly, the first question was, where was she? Matt told me that she was perfectly fine, and I had to wait a long time before I could see her. It felt like, I know it was only a couple of days, but it felt a lot longer. And if it hadn't been for Dr. DuPont, me and Liv probably wouldn't be here today. This is Olivia Lee, and she is my beautiful, healthy big baby girl.
Before we had ECMO, these patients like Harley would have died, without a doubt. She would not have been stable enough to transfer anywhere else. So getting her from one hospital to another would have been impossible. She would have died in the process.
To expand Northeast Georgia Medical Center's capacity to provide this life-saving technology, the Medical Center Foundation has included an initiative to raise $500,000 to purchase 2 new ECMO units as part of the current Healthy Journey campaign. These units will be purchased once the funds are raised. This technology, for the sickest of the sick, provides a vital service to our community and expands the health system's ability to save lives.